Well, British Prime Minister Boris Johnson is out of intensive care. He will, however, stay in hospital where he'll continue to receive treatment for persistent COVID-19 symptoms. I'm joined now by our UK correspondent Olly Barratt with the details on this. Olly, a very good morning to you. I'm sure this is welcome news for the British public that the Prime Minister is out of intensive care unit.
Yeah, very much so. Worrying times while the Prime Minister was in intensive care, because no one goes into intensive care unless they are in a very serious condition indeed and need that ICU bed. The statement from Downing Street, a short statement just saying the Prime Minister has been moved this evening from intensive care back to the ward where he will receive close monitoring during the early phase of his recovery, and the statement ending, he is in extremely good spirits. That is an upgrade, because over the previous 3 or 4 days we had been hearing from Downing Street that the Prime Minister was in good spirits even when he was in intensive care, but now in extremely good spirits according to Number 10. Interesting, of course, that he is likely to stay on that ward for close monitoring. No suggestion from Downing Street that he's going to be leaving hospital anytime soon, so there may well be a significant period of recovery ahead.
Yeah, and I suspect then, Olly, that the minister that is currently acting on his behalf, Dominic Raab, is the one that is going to continue that job for the time being.
Yeah, we're going to see more of Dominic Raab in that role, deputising for the Prime Minister where necessary, is the way that Downing Street describes it. Dominic Raab has been facing some questions over the last couple of days in the daily Downing Street press conference briefings about exactly how much authority he had. He insists that he has plenty of authority to take any decision that needs to be taken, but he was also stressing throughout that period, while the Prime Minister was in intensive care, that he had a very clear set of instructions from Boris Johnson. He knew exactly what was supposed to be being carried out on his behalf, and that he was working very closely with cabinet colleagues who were supporting him through that. Of course, the fact that Boris Johnson is now onto a normal ward in St Thomas's Hospital, and we know that he's been sitting up and talking in recent days, does mean that it's potentially likely that he's able to talk with Dominic Raab to share some of his views on where we're headed with the coronavirus outbreak and the response being led to that. But Dominic Raab told us yesterday that he hadn't spoken to the Prime Minister since Saturday, so that gives you a sense of how out of contact the Prime Minister's been over this period. Clearly, while he was seriously ill, now that he's moved back into the ward at St Thomas's Hospital here in London, it may be that he can be more in touch with Dominic Raab, but at the same time, he is being certainly told by his doctors that he does need to rest and recover properly.
Yeah, Olly, with over 65,000 confirmed cases of COVID-19 in the UK, and of course nearly 8,000 of those people who've died as a result of this virus, the lockdown, when is it likely to be lifted, or is there no telling at this point?
Well, it's due to be reviewed on Monday. That is the end of the first 3-week period, and the government said when that period was imposed that the lockdown would be reviewed at the end of it. Well, what the government is currently saying is that there is not enough evidence yet to show that Britain is past the peak of the outbreak of COVID-19, to therefore review those lockdown measures and remove some of them potentially. So what the government is effectively saying is the lockdown remains in place for now. We're probably going to go past that date on Monday into next week and then get some kind of decision about extending it. What the scientific officials and the medical advisors here in Britain are telling the government is that they need to see clear evidence that the peak of the outbreak has passed, that the curves are all going in the right direction, that the battle has been won to try and flatten that peak of the outbreak. If and when we get to that point, then it'll be the government is able to potentially ease some of the restrictions. Some reporting, for example, that schools might be one of the first things to get up and running again, because the government has evidence from its scientific advisors that schools aren't necessarily going to radically change things in terms of the spread of the outbreak here in the UK if they were to reopen. So once we get past Monday into next week and we start to see more of the effects of the measures that have already been taken in the data that we receive each day, it'll be then, I think, that we get some kind of sense about how long it all might last.
UK correspondent Olly Barratt, thank you very much for the update.